Hello friends, welcome back to the Toothache series on the dynamic dose. Sometimes toothache doesn't just stay in the teeth, it comes along with other complaints. And these associated symptoms actually help us to choose the right homeopathic remedies. Let's see some important ones. Antim crud. Here, the toothache is mainly in hollow teeth. When a patient shows you cavities and say, Doctor, the pain is unbearable in this hollow teeth. Think of Antim crud. Another remedy is Plantago, which is also very useful for carious teeth and it can even be applied locally. Antipyrinum, when the toothache is felt along the lower jaw, not just in one tooth, but spreading across the whole jawline. Then, antipyrinum is the right remedy. Now imagine a patient with hard swelling on the cheek along with the toothache. These swellings are not soft, they feel stony hard. That's a clear call for calcarea floor. Hecla lava. This is one of the best remedies when the jawline themselves are swollen with toothache. The whole jaw seems enlarged, painful, sometimes after infections or even after tooth extraction. That's when we remember Hecla lava. Phos. Some patients come with bleeding gums along with toothache. Their gums are tender, bleed very easily, and you will notice a bright red seam along the edges. This is very characteristic of Phos. Lycopus. When the pain is especially in the lower molars, not everywhere, not generalized. Think of Lycopus. Sometimes the gum are swollen. Even the glands in the neck are enlarged along with toothache. That's the sphere of Merck iodatus. And lastly, Plantago. This one is special. Toothache with earache, that is, the pain goes to the ears. It's a guiding symptom. Also, it may extend as a reflex neuralgia to the eyelids. And yes, Plantago mother tincture can also be applied locally for relief. So, whenever you see toothache with other complaints, don't ignore them. They are the real key to find the right remedy. Thank you for joining me today. If you enjoyed this, don't forget to like, share, and subscribe to the Dynamic Dose. See you soon with another episode.